Hi, welcome to TEA's 2023 Mental Health and Behavioral Health webinar series. On behalf of the agency, we are glad that you took this hour out of your day to join us. So today's webinar is hosted by TEA's Mental Health and Wellness team members. So I am Tammy Ginky, and I'm the state coordinator for Project Aware Texas. We have with us Ashton Millette, who is the mental health and education specialist here with us at TEA. And we also on our team is Julie Wayman. She's the director of mental and behavioral health with us here on our team at TEA. So our team works with the Supportive Schools Division on school mental health and safety initiatives at the Texas Education Agency. We initiated this webinar series as a follow-up to the 6th annual Advancing Behavioral Health Collaboration Summit in 2022. We wanted to take a deeper dive into the many topics and resources that were shared by the panelists in the summit. And then we also wanted to promote fentanyl awareness resources. So here we convene this hour every second Wednesday of each month at 11 a.m. Central Standard Time. And if you were not able to make the previous webinars, we do have the recordings and the supporting documents that were talked about on the webinars. They can be found at our schoolmentalhealthtx.org/webinars section of the website. And I believe Ashton will be putting that link into the chat for you. So if you have missed the other webinars, they have been phenomenal. So I highly recommend that you take a step back and look at those whenever you have the ability to do so. We do have one more webinar in our series in June that you can also register for and find it there. But today we're going to focus on learning about the Texas Child Health Access through Telemedicine, or we call it TCHAT for short. So it looks like we have a lot of people that are onboarded. So the numbers have kind of stopped for a little bit. So with that, we're going to get started on this continuous learning together. All right, well, welcome. We are using the webinar format, and I want to start with just a little bit of housekeeping. So we are hosting in a Zoom webinar format. So that means participants can't show their video or share their audio. But if you want to ask questions, and we do encourage you to ask questions, please use the Q&A function, and then we will do our best to get them answered. Ashton and I will both be monitoring that. So we want you to come and become familiar with your chat function too, which a lot of you have already done, which is phenomenal. So we're going to be dropping some resource links into the chat for you as we get started and along the way during this hour. So you can also use the chat feature to say hello, tell us where you're from, share any comments with each other as well, or any experiences that you may have. Keep in mind though, if you have questions, they are very important to us and we want to really try to answer them. So if you could use the Q&A function, that way we can ensure that we can try our best to get them answered. Okay. All right. The next thing is here, we're asking that you take a few minutes to complete this brief pre-survey before we start. So part of our mental health work at TEA is funded by Project Aware Texas. And that is a grant that was funded through the Federal Substance Use and Mental Health Agency, or what we like to call SAMHSA. The grant requires brief pre and post surveys for our awareness sessions with our stakeholders. So we really do appreciate your support with this grant requirement. So you can access the pre-session survey using the link in the chat box. Or if you want to, you can use this QR code that's here on your screen if you want to use your smartphone camera, your iPad, whatever you happen to have. So when you click on this pre-survey link, you will come to a question that asks you what is the name of the training. So if you could please enter TCHAT or TCHATT as you see the example on the screen. you could put that in the box that asks for the name of the training. That would be great. That would help us be able to match the data there. So, and you can see an example of what it looks like here on the screen. So as we move along, if you'll please complete the survey and any and post any of your questions in the Q&A. Again, the pre-survey link will be put into the chat box for you to link to also. Okay. All right. Well, thank you to everybody who completed that survey. And if you didn't get a chance to, please do so before we start. All right. So if you have not registered for future webinar sessions in this series, please feel free to do so now or at any time. You can use this QR code that's here on the slide. You can use the link that you see here on the slide, and will also be put in the chat box for you. And you can register for that. So our final session of our webinar series is June 14th. And we do hope that you attend that also. So with that, today's webinar will be recorded and it will be made available on the Texas School Mental Health website. So recordings will be uploaded to the website in about a week or two. So feel free to go back and look at any time. We will provide CPE credits for educators for today's 1 hour webinar for people attending the whole hour. A CPE certificate will be sent out usually tomorrow to the email address that you registered with. So, and this is the only way that we can get you your certificate. We will not provide a CPE from TEA for the recordings that are posted. It's only if you attend the live webinar. So finally, you can subscribe to the TEA Mental Health and Behavioral Health newsletter by using the link in the chat and selecting the Mental Health and Behavioral Health tab. So you can also select other TEA topics that interest you, and we'll continue to provide you with information in the newsletter. All right, so with having all that housekeeping stuff out of the way, I'm going to turn it over to our own Ashton Millette, who's going to introduce our presenter for today. So, Ashton.
Awesome. Thank you so much, Tammy. So I am very honored to introduce our presenter today, my good friend, Luann Southern, who is the Executive Director of the Texas Child Mental Health Care Consortium. The Texas Child Mental Health Care Consortium, or TCMHCC, was created by the 86th legislature to leverage the expertise and capacity of the health-related institutions of higher education to address the urgent mental health challenges and improve the mental health care system in the state in relation to children and adolescents. And the focus of our session today, TCHAT, is one of the programs provided by the consortium, which provides telemedicine or telehealth programs to school districts to help identify and assess the behavioral health needs of children and adolescents and provide access to mental health services. I'm also excited to say today that as of today, over 3 million students in our state have access to TCHAT. And so now, with that being said, I will turn it over to Luann to share more about TCHAT for our session today.
Well, good morning, everybody. I'm so happy to be here, and I'm going to try to share my screen. Can everybody see that? Hopefully.
Yeah, we got you. We can see you.
Okay. Well, it's so hard to be part of a conversation when I can't actually see everybody's faces, but I've noticed on the chat, you all cover the state of Texas, which, let me just say how much I appreciate all that you do every single day. I had the opportunity yesterday to participate in a national meeting that had to do with the provision of mental health services to students in schools. And they wanted to know more about TCHAT and more about what was happening in Texas. And so I was so happy to be able to talk with everyone, and yes, to say, you know, how are we doing in rolling out our services? I will also tell you, and we'll talk about this in a minute, that Texas is not the only state in the country that's experiencing significant issues with both school and mental health staff shortages. So recruitment and retention issues. It was on everyone's mind, and folks talked about it, whether they represented school districts, school campuses, or the mental health system. So I think we are all certainly in this together. So the Texas Child Mental Health Care Consortium, I put our website here so that if you want to look on there, we have a map of TCHAT sites across the state, and we have also divided those by educational service center region to try to make it easier for folks to kind of see in their respective geographical area of responsibility how we're doing and what campuses we're available in. The consortium has other initiatives as well. So I just want to tell you about one of them in particular, the Child Psychiatry Access Network, which is our child mental health consultation line. It's a phone line that pediatric primary health care providers can call to get consultations from children's mental health professionals about young people that they're seeing in their practice, where they're considered to be the primary behavioral health care provider. Because as you know, there's a shortage of child and adolescent psychiatrists. And so many children in our state and across the country are receiving mental health treatment from primary care providers. Uh-oh, now I'm having a hard time advancing my slides for some reason. Let me see here what the problem is.
Is it hidden down in the left? Sometimes there's a little, it's hard to see down in that left corner. There's an arrow.
Yay. Thank you, Julie.
Sure.
So the Texas Child Health Access through Telemedicine, I'm sure many of you are familiar with TCHAT, but for those of you who might not be, we offer several things. We do direct telepsychiatry or consultation counseling to students in who are referred to us from schools in our state. We develop memoranda of understanding with those school districts so that there's a relationship between our providers and those school districts. And who are our providers? Well, one of the things the consortium does is we divide our work regionally by health-related institution. And what I mean by that, we use the word health-related institution a lot. Across the state of Texas, we have universities, health science centers who have schools of psychiatry that also have child and adolescent psychiatry programs. So we use all of those university health systems to serve as the hubs for the provision of TCHAT services and the provision of our Child Psychiatry Access Network services and the initiatives that the consortium provides across the state of Texas. So for example, if I live in West Texas in the Lubbock area, Texas Tech University in Lubbock is going to be the provider of TCHAT services for that region. In fact, Texas Tech in Lubbock has 84 counties that they cover in the state of Texas, 84 counties that all obviously have schools in them. Then we also we provide education and training materials for school staff. That's also done through those health-related institutions across the state for their geographical areas of responsibility. And then we have a statewide data management system that serves as a repository for us for all of the data. So talks about how many referrals we've received, how many families we've been able to contact and open into our services, how many sessions we provide, what the types of referrals are, and I'll go through that information with you here in a minute. But this is an overview of the kinds of things that TCHAT does. We also emphasize all the time, and again, this was asked of me yesterday, what do you do about parental consent? So the way this works is that the school campus identifies a student that is in need of an assessment and intervention, and then the school through FERPA receives permission from the parent to make the referral. And then once the referral comes in, our TCHAT teams also get a consent signed for HIPAA reasons. So we have FERPA and we have HIPAA laws that we have to follow that result in us needing to get permission from parents and consent from individuals who are legal guardians of those students before we can proceed with our work. I notice here, I mentioned that the time to consult for us is generally 2 weeks. I know that many of you out there are saying, no, it's not. It's taking longer. We know it's taking longer. I've heard from many of you out in the state about that it's taking longer than 2 weeks. And part of that is because we do have recruitment and retention issues right now in our behavioral health workforce. So it does take longer sometimes to get a student into our TChat services. So who provides those consultations? About 10% of the young people that get referred to TChat are seen by an MD, a child psychiatrist. Most of them are seen by psychologists or other licensed therapists who are part of our teams at the health-related institutions. So this slide really talks about where we are now. And as Ashton mentioned earlier, over 3 million students are covered in our state that would have access to TChat. And that's about 55% of the total number of students that are enrolled in Texas public schools. Right now, about almost 40,000 students have been referred, and we have had approximately 83,000 sessions with students. Also, in terms of enrollment, how we're doing with statewide rollout of TChat, we have almost 600 school districts that are actively involved with us and about 4,759 active school campuses. And so we're getting there. When we first started, we had resources to provide TChat, and our health-related institutions were out talking with different school districts about our work. But as of last year, last June, there was a special session of the Texas legislature, and at that time, we were appropriated about $5.8 million of additional state general revenue to expand TChat statewide for every school to have the opportunity to have TChat. And so we have been actively working to accomplish that goal, and I will provide you with some details and information about how we're doing. So as I mentioned, memoranda of understanding are developed between the school district for provision of TChat to the schools within their respective area of responsibility. The district lead provides school contacts to our health-related institution in the geographical area so that we know our teams know who is that point person that they should be working with to onboard that particular campus into the TChat service area. And so also we then do that onboarding process where we identify who those school leads are. They're set up with our data management system, which is called TRAIT. That's where you see that name TRAIT there, for understanding how to submit referrals through that process after, of course, parental consent is obtained. And then we provide training on use of telehealth technology if that's needed as part of the onboarding process. Generally what happens, and I'll just give an example, our University of Texas Dell Medical School here in Austin is the provider of TChat services for the Central Texas region. They have a pretty extensive onboarding process where they provide education and information to the schools in their area of responsibility who are part of TChat, to introduce them to the University of Dell Medical School team, talk about the services they provide, answer any kinds of questions with details that they might have about the process, about the services, about how referrals work, all of those kinds of details associated with the provision of TChat within the school campuses of their region. And then in terms of service provision, as I mentioned, students are identified by a school personnel as an individual or a student that could benefit from TChat services. And so what we do, and I always mention this as well, that I think is really helpful. We are not an emergency crisis team service. If a student is in a psychiatric, a mental health emergency situation, they are actively suicidal, they are actively, there's some concern about harm to others, then you would go through, the school campus would go through their emergency mental health policies and procedures that they should have in place through the local community responders. We provide services to students who are considered to be at risk for mental health, mental illness and mental health issues, but that are identified by the school as a young person who might need an assessment. Maybe there's something going on in a classroom and the teacher's thinking, I don't know, something just doesn't seem right. Maybe there's problems with attention. Maybe there are problems where the student maybe just seems like they're depressed, can't focus, those kinds of things. Those referrals would come in to TCHAT. We serve that space in the continuum of children's mental health services. That is that early identification, assessment, and short-term intervention. For students who need that initial assessment, we want to be able to assess early so that issues don't become so severe that that student needs more crisis management and more intensive mental health services. Now, I will tell you, and we'll go through some data here in a minute, we do get referrals for students who do need that ongoing mental health care. And so we do provide that initial piece, but if we think that student needs more intensive services, we will make referrals to other providers or to their primary care physician who may be able to provide that behavioral health treatment, and they can get our ongoing consultation then through the Child Psychiatry Access Network. But we do get asked questions all the time about our ability to intervene in an emergency situation, and we just are not an emergency provider of services. So then the referral comes in, we double check to make certain the parent or caregiver is aware that that referral is coming to us. And then our own staff within our health-related institution also get consent from the families, so that we make sure that they provide us with permission to become involved and start providing that assessment and short-term intervention. Also at that time, the family completes paperwork. There might be assessment tools that they fill out so that the clinicians can get an idea of what's going on. And then the student will be offered an average of about 5 sessions after that initial assessment. And then they will be connected to ongoing care if they need it. I will also say, and I don't know if there's anyone on here from communities and schools, but we also refer back to some of those school-based providers and services that are available in schools for that ongoing assistance as needed. And we let families know, what resources there are. We also are very involved and engaged in information and referral, so that we can make sure that individuals are aware of what ongoing services and supports are available to those children and families who need that. This is a chart or a table that tells a story about the rollout of TCHAT. And this again is as of March 31st. That's the most recent data we have available. So you will see here on the left-hand side are the initials that start with UTSW. Those initials stand for the university health systems that are involved in TCHAT. And so UTSW, for example, is University of Texas Southwestern, which is in Dallas. And UTH, it goes Dallas, UT Southwestern, UT Health Science Center Houston is the second, UT Health Science Center San Antonio, Texas Tech University in Lubbock, University of Texas Rio Grande Valley, University of North Texas, UT Austin Dell Medical School, Baylor College of Medicine, Texas A&M University, University of Texas Health Science Center in Tyler, University of Texas Medical Branch in Galveston, and then the Texas Tech University in El Paso. So that's from top to bottom, a list of the health-related institutions that provide TCHAT services in their respective regions of the state. So you will see here on the coding, like let's just take University of North Texas. There are 434 campuses actively involved up in that region of Texas, which would cover the Fort Worth area. And then you can see here on the chart, green is active, gray are campuses that are planned to be involved. That means that there is a memorandum of understanding in place, but they have not yet been involved in actively receiving referrals or being onboarded. Then we have the orange are the campuses that are currently being onboarded. The gold is those campuses that are pending, and then the black is showing which how many have declined TCHAT services. So, and again, I'm going to provide this PowerPoint presentation also to Ashton afterwards so that he can share this with you if you are interested in having this information. But just in terms of big numbers, you'll see 4,759 active campuses, 1,132 are being onboarded, 804 we're pending MOUs being finalized and executed. There are plans to expand to 2,262 more, approximately 400 that have declined services and 45 that are inactive. This is also the MOU status. Again, this talks about how many are active, how many have declined, and how many are planned. And this just tells you by educational service center, because some people like to see this according to those ESC regions, which is very important. So you can kind of get an idea of how many campuses in the TEA regions are active, pending, and planned. So you can see here on the bottom right-hand corner where it has the numbers. Let's just take Educational Service Center Region 1. The number of active districts is 21, and the number of planned school districts is 24. So you can see that chart. And I don't know if there's any questions. I don't see any currently showing up, but I can stop at any time if anyone has questions about as I go along.
We have some, Luann, but we'll wait to the end if that's okay.
Okay. All right. And then this is just a growth chart that shows the growth of the number of schools covered by TCHAT over time. And so you will see on the far left-hand side, we marked March 1st of 2020 as the beginning point, and then we have March 1st of 2023 at the end point of these charts. And we took our first TCHAT referral in May of 2020. And I don't think I probably need to remind everyone that the COVID-19 pandemic hit us pretty heavy in March of 2020. So as we were trying to roll all of these services out across the state, we were also engaging in COVID-19 pandemic, protocols in terms of social isolation and all of those things. So we were ramping up services at the same time that our staff and all of us, frankly, all of you as well, were accommodating to the changes associated with the worldwide pandemic. So you will see that things really started picking up around 2021, but we have had continual growth throughout our beginning and up until today. And so this is a chart that basically talks about the reasons that districts provide for us about why they may choose not to have TCHAT on their campus. And so you will see here that the largest reason is that they already have telehealth being provided, either through an app or through a contract that school district may have with another provider who provides those types of services for the students in their district. So you'll see that almost half of all campuses, that's why It's because they already have a provider. And then we have also 22.6% that already have existing mental health providers outside of a telehealth provider. So the majority already are saying they have services in place. And so they don't think that they need T-Chat as well. So they're already covered. And then you'll see that there are other colors here, lack of staff or space or resources on campus is also a reason you will see. So this on the conference that I had yesterday, the meeting, this was talked about, that when you add a new program or a new service, campuses also are very strapped in terms of trying to identify rooms or spaces for students to be able to have those confidential sessions with someone. And so that's also another reason. And so you can see here from this pie chart. And then on the left, we outline the school districts and the reasons for, like, if you'll see on lack of staff or space, Matagorda, Melissa, Odyssey Academy, Sabine Pass, Texarkana, and Wharton were concerned about not having the space for students to be able to receive those services. So challenges with implementation and in terms of our rollout, I had mentioned some of this before, but the availability of the mental health workforce, recruitment and retention of our mental health staff across the state, and it's not just T-Chat, it's everywhere, other providers, nonprofit providers, hospitals, outpatient services, governmental entities. We just hear this all over the state. We also know that schools are having issues with recruitment and retention. And so all of us are in this space right now where those lack of staff and hiring and retention is causing lapses sometimes in our ability to see a student more quickly. And so that's affecting us. School buy-in for the provision of services on campus. Again, some schools, because of different extenuating circumstances, just are not ready to have T-Chat there. And what I want to say about that is our goal really is to provide every school the opportunity to have T-Chat. It's not that, I think many schools just are feeling like they already have services, as I mentioned previously. If we give them the opportunity, they have a say in whether or not they are equipped to have T-Chat at that time. And for those who say, right now, we just don't feel like we have enough space, or there might be other reasons, even ones that say they already have providers available, we always tell them if that changes, please let us know, because we are here for you if you need us. And then also school staff impacts. So having a person at a school identified as being our point of contact, we know that campus staff are just really inundated with things to do every day. And so being able to find that person to be a liaison with our T-Chat teams. Then also just sometimes challenges with connecting with different schools and districts. And with this, we have had a great success in working with the educational service centers and linking with the ESCs to help us with this. And it has been wonderful. And I feel like we had a meeting, Julie coordinated, that brought together the educational service centers and our consortium T-Chat folks. And it was just a wonderful meeting to talk about the different issues that all of us are facing, to talk about how we can work together, to talk about linkage and referral, talk about the needs of students across the state, talk about different regional uniqueness of different regions and their needs. And so we want to keep those conversations going. We just felt really good about that, and educating each other about what we do too. The ESCs play a key role in assisting us with that, as do school district staff. So we appreciate the relationships that we've been able to develop with the school districts and the staff on campuses. It's just been greatly appreciated. Also, just in terms of timing, those MOUs, memorandum of understanding, can sometimes take time. It's a legal document. It has to be reviewed. There might be some nuances in there, some things that need to be edited and modified according to the specific school district and what they would like to have in place in terms of those documents. And that can take time. The onboarding of schools, schools are busy, staff are busy, and we want to be accommodating to the school calendar. And so making sure that, we don't become just another thing that they have to do, but we're seen as an enhancement to services for children in the campus, and also to understand the kinds of time constraints that school staff are under so that we can work with them and accommodate their schedules. And again, recruitment of staff. I know I've said that many times, but it is an issue for us. And then also the purchase of technology that would enable the use of telehealth across the state within different areas of the state. I will tell you that I mentioned here, I didn't talk about the internet infrastructure in rural areas. This was also something that came up on that meeting I attended yesterday with other school-based mental health providers across the country. This obviously is an issue in rural areas, but it was also brought to the attention of the meeting participants that this can also be an issue, not just in rural areas, but in urban areas as well, or just with individual children and families not having access to the internet. And that sometimes that can impede the ability to be able to provide services using technology. And this is my last slide. And let me just tell you about this slide. So this is Teacher Appreciation Week. And this is a picture of my twin sister and I in first grade in a very, very small town in Kansas. This was the total of our class in Kansas. And this was my first grade teacher and our first grade class. And I just appreciate teachers so much and just want to give a shout out to the schools in Texas for all that you do, because really, when you're in first grade and kindergarten, that sets the tone for the rest of your life. And I just wanted to post this because I appreciate Mrs. Brandenberger. She was my first grade teacher so much, and just the course that in education and learning and the importance of schools and teachers. So I just wanted to say how much I appreciate all of you and all that you're doing out there. So thank you very much for this opportunity. And now I'm looking forward to the Q&A.
All right, Luann, we have lots of questions for you today. Okay, one of the questions is someone would like to know, how is the program funded?
Oh, sure. So we received our funding initially and currently from the Texas legislature. So our funds come from state general revenue. And then last summer, when the special session was held, the legislature also appropriated some federal ARPA dollars. ARPA are the funds associated with the COVID-19 public health emergency. So we also received federal funds through the Texas legislature as well. So those are the two funding sources that we have.
Okay, thank you.
Mm-hmm.
Oh, and too, I meant to start off with this comment, but let me say it now. Molly had commented in the chat box that she had a student who just got out of a T-chat session and the child left smiling. So I just wanted to highlight that wonderful, wonderful comment there.
That makes me very happy. When we make kids happy, we should all be happy. That's awesome. Thank you for sharing that.
Okay, so another question is, can you talk to us a little bit about the providers of the students? Is it interns? Is it, who exactly provide them?
Sure. So the individuals that are on our teams are clinical staff and non-clinical staff. And what I mean by that is we do have LCSWs, PhD psychologists, LPCs, LMFTs, all the alphabet soup associated with the credentialed mental health providers. And then some of our sites also employ individuals like care coordinators, case managers. We have a site that uses community health workers to help with linkage and referral. And so it's a combination of all of the above. And if a student is needs an internship, like toward their clinical degree, like social work degrees, psychology degrees. Some of those students also do come and do internships with our TCHAT program.
Thank you. So here is another really good question. If a student moves districts, will they need to change providers?
Oh, that's a good question. I
Really?
wonder if that's come up. I would think that they would not need to, simply because it's a telehealth service. And so they can see that provider consistently, because we provide short-term intervention. So let's say that I'm a fifth grader and I am seeing a TCHAT clinician at the University of Texas Medical Branch in Galveston. And my family moves to Houston. And I am actively engaged with my TCHAT team in Galveston, in UTMB. But now I moved into Houston, and there are two providers in Houston, Baylor College of Medicine and University of Texas in Houston. I think I can still see my UTMB team because I'm being seen through telehealth, and the services are short term. And so what would be required is for the clinicians and the clinical team that's working with me in Galveston to know and understand what the resources are for me in Houston, though, if I needed longer term intervention. And so I would want to work with, have them work with my family to help me link up with ongoing services in Houston, if that was where I moved. But for right now, I don't see an issue with them needing to change because of the nature of telehealth. Because you don't actually have to be in someone's office to be provided with services, and because we're short term.
Thank you.
But let me say this: if anyone has run into that, please let me know, because I would love to talk through that with you and talk through that with our medical director, who's Dr. Laurel Williams at Baylor. We can talk through that.
Okay, thank you. I thought that was a phenomenal question. I had not thought about it before.
Me neither. I like that.
So another question is, can a student be referred more than once? Like,
Yes.
they're referred, the period of time has passed, and then let's say they need another referral.
Yes, that has happened in the past. I'm aware of that happening.
Thank you. Are sessions offered only during school hours?
Not necessarily. Sometimes, and again, this depends also on the geographical area and the health-related institution. Sometimes services we know have been offered after, just so the family can be involved, but it's not consistently that way. A majority of them are offered during the school hours.
Yeah. All right. Another question is, someone had asked about the cost to school districts and student families.
Oh,
So this
the
is a
cost?
great answer, right? Yeah.
the cost? We provide our services for free. We do not bill for our services. The Texas legislature appropriates resources for us to do our work. And in order for us to be accessible, because access to care is one of our goals and one of the reasons we were created, we do not bill for the services, and we do not charge school districts to have TCHAT services.
Okay, thank you. So Lillian, in one of your slides, you talked about the concerns or the barriers, and we have a guest to the webinar who would like you to, kind of talk more about if a district uses TCHAT, and let's say there's concerns, whether it be concerns about the wait list, the student schedules, response, those kinds of things. How are those concerns being addressed once the district brings it to your attention?
So you know what? I just noticed that I have a TCHAT person on this webinar, Constance, and I would love, I feel like here I am talking all this time, and Constance is on the ground over at JPS in Fort Worth, and I'm glad you're here, Constance. Do you want to answer that question?
Dang, she her camera and her mic is disabled.
Oh,
So
okay.
she can't come off screen. I'm sorry.
That's no problem. So ask the question again. I know Constance is saying ask it again. but ask it again, and then she can answer and I'll answer too. And maybe if I don't answer correctly, I know Constance will correct me in the comments.
Excellent. Okay, so just kind of the journalization of the question is, if a school district has access to TChat, and there are some concerns that come up,
Yes.
the district wants to raise with TChat, how do they go about that? How are the concerns addressed? Those kind of
Okay.
things.
Yes, if there's a concern about TChat that the school raises, we want to know about it. And the best way to do that is to talk with the person in charge of TChat at the health related institution. And I can actually get that information to everyone on this call. I know we've provided it to the ESCs, to the educational service centers, who the leads are at each one of those health related institutions. And we would be more than happy to share that information with you as well.
Oh, great. And so Constance does have a comment. And
Yes.
she said, yes, that they will always want to know, and to please reach out to your hub, such as herself, and then they will call you directly. So, yeah.
Thank you, Constance.
Thank you so much for addressing that there. So we may have those on the call who may be associated with the school district who are like, how do I get the MOU rolling? How do I find out? I know you mentioned in your PowerPoint presentation about how to find your person for your area, but since there are questions about that, do you mind talking a little bit more about, hey, I am in this particular area, how do I find out, and how do I get the ball rolling so that we can get the MOU signed?
I love that question, because that means that you would like to have TChat in your area. So we get questions like this all the time from all over Texas, from different school districts. And if I can know your name, what district you're with, then, and in fact, you can send me an email, and my email address was on that last slide, Southern. Well, I'll put it in the chat. But anyway, you can send me an email. I will link you to the point person in your geographical region of the state who's responsible for making that connection, and we can get the ball rolling.
Excellent. Thank you. Let's see here. We have someone is asking, can anyone speak to how this looks like in practice? So being the only counselor in the district, what exactly does it look like? Let's look at it from a counselor's lens. So let's pretend we're counselors. How do we make referrals? What happens after the referrals? What are my duties as a school counselor in helping students and families get access to TChat?
So the school counselor would identify a student, or someone else in the school might say to the school counselor, I have a student in my 5th grade class that I'm concerned about. You would want to talk to that counselor about it, explain why there was a concern, and then the counselor would initiate a conversation with the family and say, your son or daughter's teacher or someone else at the school has expressed a concern about your son or daughter, and it seems like they're having some issues in class. We would like to make a referral to a service that we have available in our school called TChat. And then they would explain what TChat is, talk with the family, make sure that the family signed consent for them to make a referral to our TChat team. And then that school counselor could directly make contact with the TChat team at the health related institution in their area. And our health related institution would want to make certain there was parental consent and information was completed by the school about that student. And then that referral process would start. And then our health related institution team would take that referral and the information that was provided by the school counselor to the family and get consent from them, and then initiate the TChat services.
Excellent, thank you. So do parents have a role in choosing the provider for their child, or do they get to have any preference, or is it talk about that if you don't mind.
Well, what I would say about that is our TCHAT teams in every one of the HRIs, like if a family said, oh my gosh, I would prefer to have a woman therapist, for example, or I would prefer to have a person of color. We would always try to make sure that we could, if the staff were available and if we had a person that could do that, we would want to assign them to a person that the family felt comfortable with. Because I think that's an important part of the process, the therapeutic process, is to be able to help families and children feel comfortable. Now, sometimes that may not be possible based on our staffing and, any recruitment, retention issues, that kind of thing. But I think that our teams always try to be as accommodating as they can to parents and to help with the therapy in the process.
Thank you. Kind of many or several questions we've gotten. I'm going to summarize it into this question. Who can refer to TCHAT? Is it only school district personnel? We had one question mentioned CRCG. We had another question that mentioned parents, community providers, those kinds of things. We talk a little bit about who can refer.
This question comes up a lot. And so what we always say is the referral has to come through the school. So let's say that a CRCG met and they identified a young person in a family through the CRCG process, which is a community resource coordination groups. Then they could talk to the school and first off, make sure the school has an MOU or is involved with TCHAT, because some schools aren't. And so, but if TCHAT was available, then they would contact that school counselor or whoever that point person is on that campus and say, hey, you know what, we had a meeting about this young person in our CRCG today. We kind of feel like maybe they could benefit from TCHAT. What do you think? And then that initial referral can come in, but it has to come in from the school. So even if a parent said, to the school, someone at the school, the teacher or the counselor, I'm really concerned about my son or daughter's behavior, and are there any resources that you're aware of? And then they could say, well, actually our school has something called TCHAT. And if, and they could talk about TCHAT, the parent would give permission for that referral to happen.
Okay, thank you. Time is running out and we have so many questions left. So I do want to ask one more question and then we can kind of close out the webinar here. But just for points of clarification, for the MOU would come from TCHAT to the school district, or how does the MOU development process work?
Yes, the MOU is between that health-related institution. So for example, Constance, who's with us today, is with the University of North Texas JPS up in Fort Worth. The MOU would be between those entities, UNT and JPS, and let's just say Fort Worth School District. So that's where the MOU, it is the relationship between that health-related institution and the district. And then the district decides which campuses on their district they want TCHAT to be in.
Thank you. There are so many amazing and great questions left, but unfortunately we're running out of time. What we will do, Luann, is we will get you these questions. And if you want to type up some answers or anything like that, we can put that on our School Mental Health Texas or tx.org website as we post this other material. Because there are, like I said, there are a lot of other great questions. So,
I would be happy to do that. I will also post that list of the contacts in each one of those health-related institutions so that you can know who the lead person is to talk to.
Great. We thank you so much, Luann, for taking this time out today to share such great information about TCHAT. And this is just a really amazing resource that has been given to us, and we really appreciate your time for jumping on. So thank you.
Well, thank you, everyone. And as I said, I appreciate all of you and the work that you do. What you do is so important. And so thank you.
Excellent. All right. Well, with that, we are wrapping up another installment or episode of our webinar series. This next slide is going to show you the post-training survey link that we talked about before. So if you don't mind, you're going to find that the questions are going to be the same or similar to your pretest, but this is very important for us in funding with Project Aware and our grant requirement. So the post training survey link, you can find the QR code. The link is here. Please type in TChat. So don't forget to sign up for our remaining webinar that's going to be happening in June. You can register, at our schoolmentalhealthtx.org website. And remember, you can subscribe to the TEA newsletter. And also, too, please don't forget to visit our Texas School Mental Health website there. Also, we wanted to highlight one important final resource, and that TEA has compiled fentanyl awareness resources for you at the request of state leadership. And so these resources have been shared with each school district as well as along with other tools. But there is a document at the link that will be put into the chat that you may want to look at from there. Julie, with the last 2 minutes, is there anything you wanted to say?
Well, I just want to send gratitude for everyone for coming today, for your interest in our student mental health and accessing services, all the great questions. And of course, gratitude to Luann for being here to share. This kind of networking is important to us in Texas, in our big, huge state, to be able to get the word out about how every child, every family, every school has the opportunity to have this resource just in case you need it. Even if you have other resources, it sure is nice to know that you have these wonderful higher education research experts and psychiatrists and therapists at our fingertips, while we all work together to build our workforce so that we can wrap ourselves around more students and families. So thank you to the consortium and to Luann for what you all do to support our schools and our students and families. Thanks everyone on this call for what you all do and for being here. And please join us next month and stay in touch. Let us know if you need anything. Have a great afternoon.